And the clinic opened in the year 2000, and I started a year after, which is 2001. I started here at the clinic when we actually only had one truck.
Historically, it started as a very small operation. We had 5 to 6 students here, and we alternated a mobile or home clinic.
I had to take the one truck we had, and then I would go down to the creek, we get water in buckets, fill it up in a drum, bring it back to the clinic, and that's how the students would take the shower. I've watched the clinic grown from talking about vehicles, from one vehicle to we have 5 vehicles now. Staff has gone up to 19 people. Back in 2004, they drilled this well and installed all the equipment needed for us to have water for the dorm and all the rest of the building. So now the students can have shower regularly. We're never out of water since then. So this is a blessing. Okay, right now we're looking at the main building on the compound, the BIS building. The first floor is the clinic. Second floor is office, and there's a storage space, and the third floor is for meeting. Every Friday the staff meets, and upstairs is where we use for a meeting space. Down here we have what we used to call education center. We used to use this building for presentation for the students, and now we run a PT program here at Hillside, and this building is used for doing all the PTs, seeing the PT patient that comes here. You're looking at Abby's house. I also mentioned that this house was built in remembrance of Abigail Brinkman, who passed away in a tragedy here in Belize as a student. Mr. Roger, the dad of the girl that passed away, turned something good out of the whole tragedy.
Thanks to the Abbey House, we have a capacity of 14 students per month, and we can now have mobiles and home clinic happening simultaneously. So 4 days a week, we have at least 4 students, 5 students in the home clinic providing care to the citizens around Eldridgeville, in addition to at least 1 mobile unit, sometimes 2, going out into a village.
We have students who are rotating here for a month at a time, and generally they are the first contact for patients. I think that's another thing that we really try to focus on here, is teaching future, clinical providers.
I've done a number of global health sort of work opportunities, and none of them have looked as team-based as this. I think it's a really unique model, and I think the students walk away with not only feeling empowered, not only a better understanding of global health, but really understanding what a team-based model looks like, and that's the direction we're moving in terms of better healthcare.